In this world of technology, things are ever changing, rearranging. You need someone to help you out. I know someone who can. Come and take a journey with me as we go through the land of technology. You'll never be alone. You'll be with Paul Amadeus Lane in the Tech Zone.
Welcome back to the Tech Zone. I'm Paul Amadeus Lane here on ABC News Radio KMET. Hope you guys are staying well. Hope you guys are staying safe during this trying time with COVID-19. The segment of the population that really concerns me is our aging and adult population. I have two parents. They're in their 80s. I have family members that are over 60. And I'm really concerned about them. I'm concerned that they're getting the medications that they need. I'm concerned that they're maintaining social distance if one's come to visit them and not put them in harm's way. I worry about them if they are in any close proximity with anyone who is not in the household. There's one company in Israel that's really working to meet this challenge when it comes to making sure they're getting their medications, a way that we can monitor it as well, and to really show us what the future of medicine looks like when it comes to digital health. I'm so happy to check in with my friends in Israel to check in on how they're doing and discuss this amazing platform and how it's really, really going to change lives. Joining me right now is a great friend of mine all the way from Israel, Leon Pegrovsky. How are you doing, Leon? Great to see you, my friend.
Hi, Paul. Thank you for having me here. Really a pleasure.
Leon, the last time we saw each other, we were in Vegas having a blast at CES, joking around, talking about how cool it is to be in Las Vegas. 3 months down the line, we're dealing with this epidemic with COVID-19. And Leon, how are you doing in Israel? What are some of the restrictions they have you guys under out there?
Yes, it's in Israel. It's like all over the world now. It is pretty tough. We already more than 2 weeks at home. We are not allowed to go out to the work. Only the medical personnel, the army, and the people who are dealing with the food. These are the positions that are allowed to go out. Everybody is working from home. But luckily for us, we are. It seems like we are getting it under control. The cases are going down. We have less cases than we had 2 weeks ago, so it's a good feeling now. It's a lot of family time now, much more than I have in my usual overloaded schedule. You know, I have 3 small kids, so it's pretty crazy now to work from home. But it's really nice as well, because usually you don't have so much time to spend with your family. So, but what we saw that every crisis brings a lot of opportunities as well. So we saw that there are a lot of people in need now, and who are pretty struggling to get help from the others because they are under quarantine. So, and the people, those people usually were getting help from their family, or maybe paying for their help. And we saw that there is a lot of opportunity to make our technology, and maybe to make small adjustments and to help those people.
And Leon, so, that's what I think is incredible, my friend. The technology that you guys have. When we had our discussions last year at CES, we both had no idea how this would be used now with one's in quarantine right now. And Leon, talk about the specific need that you guys are really fulfilling when it comes to this crisis, when we're under quarantine, especially when it comes to patients maintaining their pharmaceutical regimen. Why is that so important? We know why it's so important, but for ones who are not on medications, who may have family members on medications, who may not understand just how important it is, can you explain that for us, my friend?
Yeah, sure. First of all, almost 80% of the people who are above 55 getting more than 5 medications daily, or some supplements, or so they have quite a packed schedule to follow, and it's very hard to do that in a day-to-day life when you have your routine. And now, when we are at the quarantine, our routine is broken. The people who are coming to our homes to help us with managing this, sometimes people have their children coming in arranging their pillboxes. Sometimes it is some nursing houses, etc. So people are really struggling to follow their schedule. And these actually are the people who are in the biggest risk to have the coronavirus, and this population needs the biggest help. So we saw that there is a huge gap currently, and we have a lot of people who are trying to help elderly and some people with accessibility problem from the remote, from the phone, from the video calls. But to the physical touch, it's really hard to bring to those people. It's almost impossible, because it makes them it could make them sick, or it could make sick the healthcare professionals or those who are coming to them. So we saw that our technology, which is actually a smart dispenser, which could be programmed and provide a prescription, based on the prescription, provide the specific pills to the specific person. It can manage virus profiles and can manage inventory, and it is very, very simple to set up. Actually, with the push of a button, you get your actual dose of what you need to consume. So we saw with this small adjustment, we could really address this need.
I love it. I love it, Leon. And when we look at just how overrun the hospitals are, and ones are not able to go to their regular routine appointments, and doctors now are really integrating the teleconferencing now. They're doing a video consultation for patients and things like that. And it's nice that this platform exists. So let's say that the doctor prescribes a new medication. How does the Nutrical work with that, so that the patient doesn't have to go out and make contact with ones, and ones coming in their home? How does that transition work? Do doctors have to be a part of the program? You mind explaining that to us, my friend?
Yeah, sure. So first of all, the person has his prescription, and the doctor provides this prescription. But this prescription is going into our platform. They define the regimen of the person. The drugs that the person needs to consume are delivered to his home, and those bottles are very easy to. The pills are very easy to set up into the device. You just need to scan the bottle, and the right compartment opens up, and you just pour it in. You don't need to set up all those boxes as in the past, all those plastic boxes that we were bringing some nurses or some children for the parents. We're arranging them based on the schedule. It is all programmed and all controlled and monitored. So the people in the under the quarantine could be followed by the healthcare professionals or their family, and the alerts could pop up if the schedule is not doesn't meet. In addition, the inventory and the shelf life and the batch numbers are tracked in the device, so you always know when there is a need for the refill of the prescription, and whereas maybe there is some drug that is expiring. So you need to fulfill a new bottles and send them to the people's home. So we're reducing the touch with the person, especially now, as I said before, it reduces the risk of the people to be sick, and the people who are under quarantine, it reduces the risk of the personnel to be sick as well. So it both sides. It contributes to both sides. And taking your comment about that, everybody is now in-house, inside. So we actually today in Israel, there are huge hotels that were recruited for this purpose. So a lot of people who are sick with the coronavirus, they are going to the 5-star hotels, which are only for the people who are sick with the coronavirus. And there is like divided to 2 parts, for the healthcare personnel and for the sick people. So it's really cool.
Yeah, definitely. They can be comfortable in style, right? They can definitely.
It's a good side, let's say.
Yeah, absolutely. And Leon, one of the things that you talked about that really warms my heart with the Nutrical and this platform is that doctors and family members can keep track of how the medication or the supplements are being ingested by either our elderly grandparents, parents, and even ones who have underlying health issues, to make sure that they're being safe, because we can't hop in the car like we used to go and check with. But now we have this piece of innovation right now. We can really monitor how they're doing it, and I think that's incredible right there. And Leon, what else about the platform now, since we're under quarantine, that you really would like the public, the healthcare professionals out there to really understand why they really need to put this in part of their care for the patients?
Yeah, I think, as I said, this time provides us a huge opportunity for transition. A lot of people didn't want to adopt the digital health technology because they were afraid it is not so accurate, maybe the technology is too complex, and etc. And now with this quarantine, the world will change, and it will not be the same. We see those, as you said, the meetings, online meetings that we have with the doctors. We have all those variables to monitor our conditions, but the delivery of the actual treatment, it still requires the personnel. So the smart home device and IoT platforms, those are the platforms who really could reduce the touch with the person if it is not necessary, and be much more accurate and provide in the real time the treatment. So because nurse can't really be with the patient all the time. It just prepares she just prepares the pills, and then the person needs to take it. And we can track when exactly it was taken, prevent dangerous interactions, and maybe to monitor when nobody is with this patient. So we believe that even after all this tough time, after it will pass and the coronavirus will be in the history, the digital technology is there to stay, and the way we're getting the treatment is going to be totally different. And the solutions like ours, smart oral solid pill dispenser, which can provide service for all the household and for the people with different accessibility problems, those solutions are going to be part of the mainstream treatment. And this will be like the beginning of the value-based care, because you really can track what it was done and not just trust what was written in some record in some hospital or whatever. So this is my opinion.
So Leon, this is amazing, this application right here. So when is it ready for rollout? Or can doctors contact you guys now, healthcare professionals, even consumers out there? Can they contact you now? How does it work, my friend? When can we get it?
We are adjusting our system to support the pharmaceuticals actually now, and it will be ready in few months during this year for all the public. You actually can go into our site nutrico.com with double C and pre-order it now. So, and you will get a better deal, and you will be the first to know.
Awesome. So Leon, before I let you go, is there anything else out there you'd like to speak on to the viewer, the listener, the healthcare professional, anything else out there before I let you go, my friend?
I just want to say that those times, once again, they are pretty challenging. You know, we're under quarantine, it's pretty tough, and all the economic situation is going down. But we will succeed to grow from that, and there is a lot of opportunities, and I'm sure it will pass, and we all together will see in totally new world with a lot of new technologies and a lot of new opportunities for growing.
I totally agree, my friend. And Leon, great to see you, my friend. I hate under these circumstances, but I'm so glad to see that you and your family are doing well. The rest of the team over there, Aviva and everyone, tell everyone we said hello. They're in our thoughts and prayers, and we look forward to seeing you guys face to face when all this is lifted up.
Thank you very much, Paul. It's always a pleasure. Really, I love talking to you. Thank you.
Same here, my friend. Take care. A huge shout out to CEO and co-founder of Nutrico, Leon Pirogovsky. I love Leon and the folks over at Nutrico. What they're doing is really transforming and changing lives out there. So please contact them, healthcare professionals, consumers out there. This is something that's really going to change the game. So definitely reach out to them. All right, when we get back, we're going to talk about how, in the midst of COVID-19, how children are able to still be educated, to go to school virtually, and how some parents are like, thank you. We'll be right back here with more show. This is the Tech Zone. I'm Paul Amadeus Lane.
In this world of technology, things are ever changing, rearranging. You need someone to help you out. I know someone who can. Come and take a journey with me as we go through the land of technology. You'll never be alone. You'll be with Paul Amadeus Lane in the Tech Zone.